Hey everyone, it's Live with Dr. J. How are you, Dr. Johnson?
Excellent, thank you.
Good. So we are talking about fall allergies, what you can expect, and really how to combat it. Can you tell us a little bit about what we're seeing right now?
Well, right now the grass pollen's out, but shortly there will be ragweed, and ragweed's the big fall pollen that gives everybody trouble. It used to, called ragweed fever. People get sick enough that they develop inflammation and fever with it, and it is all over the Midwest, west of the Rocky Mountains and Continental Divide. There's a different kind of ragweed, west and south. Usually it starts up around August 15th, depending upon the climate. It can be earlier or it may be delayed a little bit.
Right.
And typically it causes itchy eyes, runny nose, congestion, and if it's bad, people get headaches with it and really feel fatigued and just can't function very well.
Yeah. So what are some of the ways that you found are best to combat it for people?
Well, with ragweed, many people, if the symptoms are mild, can use antihistamines. Some people need a steroid shot to get the inflammation calmed down. The best way to combat it is to get on allergy shots and build up tolerance to it. And with the allergy shots, over a period of time, which is months to a few years, you can build up good resistance and not have much problem with the ragweed allergy.
That would be huge. It comes around, you see everyone else suffering, and you're just doing great, right?
Exactly.
Yeah.
Exactly. Yeah. And so to find out exactly what you're allergic to, you need to skin test. Right. You can do blood tests too. They're not quite as accurate and sensitive as the skin test. So if you know you have allergies or suspect you have allergies and it's pretty consistent the same time of year, and you've been tested by a blood test and it's been negative, get a skin test. Now, most allergists do prick test. They're not as sensitive as the intradermal test, so you may have to ask for an intradermal test. We do intradermal test here in the office to make sure we're picking up the allergies that the patients have.
And what does that kind of consist of? Can you kind of explain just that process for people?
Yeah, the process is you take a small amount of the actual substance that has been extracted from whatever the weed pollen is, and you inject that in the layers of skin. You make a little wheel like a TB test, and your skin then responds if you are sensitive, and it causes edema to occur, and we call that a wheal, and it then grows, showing a positive test.
Right. What if someone is allergic internally? Would it still get a little bit inflamed that way?
The skin is a good indicator. So yeah, it works for testing foods, which you ingest, and foods can cause asthma, can cause edema, can cause throat swelling, hives, all kinds of things. So skin test is a good way to pick that up because it creates that histamine response, which then creates a positive skin test, which is what happens on a grander scale when you get exposed.
And you've talked about some of the symptoms that you might see from that, and some of the symptoms that we might be experiencing as the fall comes around. Can you tell us the way to always differentiate between a cold and allergies? Because I find myself sometimes struggling with that.
Well, a lot of the symptoms are the same.
Yeah.
You get nasal congestion, and you get headache, you feel fatigued. Usually with the allergy, you do not get a fever, where a lot of times with an infection, you'll get a fever. The other thing, most allergies, when your nose runs, it's clear, or what you cough up is clear. With an infection, a lot of times, it's yellowish or greenish, and then you're running a fever with it.
Okay.
So that's one good way to kind of screen it a little bit. If it is getting worse and you're getting worse and worse, then be sure to see a doctor, because most likely it's infected. And you can have an allergy and then you get a secondary infection because it messes up the mucous membrane defense mechanism where the bacteria can take over.
Wow, okay.
Now, with other thing with fall allergies is that you may start to develop some food allergies with it, or you notice that when you drink milk or have dairy products that you're getting allergic reactions. And that's because the cows eat the weeds that you may be sensitive to, and the antigen comes through in the cow's milk. So if you're grass sensitive, when the grass pollinates in the spring, you may not tolerate milk as well. Same thing in the fall if the cows are eating the ragweed or some other weeds that you're sensitive to, the antigen comes through in the milk. Just as with babies, if babies are having croup and colic, we test the baby to see what foods they're sensitive to, but put the mother on the diet,
right?
Because the antigens come through in the breast milk when they're breastfeeding.
You know, I always forget about that. Of course, the stuff that we're ingesting, if it's, you know, a byproduct of an animal, it's being ingested by them first.
Exactly. And then it's the antigens are secreted through the milk.
Yeah. One thing I had a question with that, you know, you're talking about milk or, you know, through in the seasons. What about over years? As you get older, how frequent is it that you develop new allergies, or is it different every person?
It's different with different people. Genetically, there's people that are more predisposed to allergies than other people. Yeah. And if you get exposed too much to one thing, then you may develop allergies. The other thing is there's different things that potentiate allergies, so that certain chemicals will do that. Terpenes, which are the scented type products, are sensitizers. Yeah. So if you're exposed to a lot of scented products, you may start to develop allergies if you're one that's prone to it. Sure. So that can happen. If you have like a flood in your house and you don't get it cleaned up and dried out fairly quickly, then mold can grow, and mold then can be a sensitizer. It can develop allergies. It can increase your allergies. And that's one of the things you have to be careful about in the fall when kids are starting back to school. The schools have been closed up. A lot of times air conditioning hasn't been run in the summer. If they haven't had water leaks, or they cleaned the carpets in the spring and didn't get them dried out quick enough and they close it up, then you can get mold growing in the schools causing allergy symptoms like itchy eyes, runny nose. Kids just don't feel good. They can have stomach aches from that. So if the kids are having trouble, they complain about, I don't feel good at school, then it makes sense to look and see, you know, what's going on. Go visit the school and see how you feel as an adult in there.
That kind of popped up a question. You kind of already answered it, but tell me really what parents should know as they are sending their kids back to school, and some things that they should keep in mind for this season.
Well, one thing is yes, go visit the school. Yeah. Know where your kids are and know what's going on. If they're eating lunch at school, it's always good to know what the kids are eating, particularly if your kids have certain allergies, because they can be accommodated in many cases. Some cases they can't, and you have to provide food then for your child if they're very sensitive. So that's important to see. So the environment, go visit the classes, see where they go. They always typically have a visitation day for parents or educational day to get acquainted with the teachers and see what the kids are doing. And that gives you a chance to look at the building, see the individuals that are there, and then what your kids are being exposed to.
Absolutely. Is there anything else that you really want people to kind of take away and keep an eye out for this fall?
Well, this fall, basically, pay attention to the news, the ragweed when it comes up. If you're having problems with it, they have fall tree pollens that are out there. And then In December, January, February here in Texas, we get mountain cedar.
Yep.
So that comes along and creates similar symptoms of ears, nose, and throat irritation and congestion, and can cause fatigue and inflammation. So those are things to look for in the fall and in the coming school year. The one thing that I kind of warn people about is looking for those plug-ins.
Okay.
If people are plugging in plug-ins, they're trying to cover up something typically.
Yep.
And that may be mold contamination, that musty, damp smell, those black molds that grow behind the wall can produce toxins which affect your nervous system, ability to concentrate, or maybe other chemical odors that are present that someone's trying to cover up.
Yeah.
Years ago, we had more trouble with pesticides because they used a more toxic pesticide indoors. That's not so much the problem anymore, that they're much safer with it. But some people do have trouble with even the scents that are put in different products that are used. Yeah. So just be aware that can happen if there's a problem or child is having difficulties. Then makes sense to see what all is going on and ask questions.
Absolutely. Definitely good for parents to be aware of, and everyone to be aware of, really. If people have questions and they weren't able to ask it today, what is the best way to contact you?
Best way is go on the website at johnsonmedicalassociates.com. There's a place you can click and ask questions, and you can get a response. Call the office. We have people here that can assist in answering questions. It's not, office number is 972-479-0400.
Great.
And be happy to help.
Awesome. And of course, we do have the Facebook page as well, tagged above in the post, so that if people have questions, they can also head over there and see more information. And this will be posted to YouTube, so if people want to rewatch it or find out more information, they can always go there as well. Dr. Johnson, thank you so much.
Thank you. Have a good day and a healthy fall.
Yes, fingers crossed, right?
Yes.